Hey there, I'm Jessica Roocroft, and thanks for joining me for this quick presentation today on the influencers of your gut speed. 5 often missed things that might be causing your diarrhea or making it worse. As you well know, IBS diarrhea and all things diarrhea related are my most favorite things to talk about. So I hope you find a lot of value from this presentation. If you enjoyed it, please subscribe, give a thumbs up. Head to jessnurses.com as well for a free IBS-D mini guide. Lots of other resources there at jessnurses.com. So let's dive in. So what we're going to cover today are the mechanical influencers of gut speed, the chemical, meaning pharmaceutical and endogenous influencers of your gut speed, dietary influencers that make things go faster, neurological influencers on your gut motility, microbial influencers of your gut motility. All these factors can either increase or decrease your gut speed, but we're going to highlight the things that I see commonly increase gut speed. And hopefully, while this presentation is for your general information only, obviously, follow up with your healthcare provider because it could help spark a discussion. Obviously, I am a dietitian, but I'm not your dietitian. So make sure you take this knowledge with a grain of salt and go back to your doctor, your gastroenterologist, your dietitian, and ask them about certain factors that could be making your diarrhea worse. And I hope this kickstarts some ideas for you. Okay, this slide is short and sweet. Mechanical factors that can increase your gut speed. High impact activities. This can physically jostle your gut mechanically and get things moving. Also, while, say, running, for example, blood flow to the gut is reduced, impacting digestion. This could possibly lead to diarrhea. So that's not just running, but it is also any activity that is diverting the blood from your gut to your extremities, which is what your body's job is while you're exercising, so you can actually physically move. And it's less influence on the rest and digest mode at this time, right? Dehydration from higher impact or longer activity movement, especially if it's hot out, that can also exacerbate diarrhea or trigger it. So I wonder if that tips anyone off if you are someone who experiences runner's diarrhea or you experience your diarrhea only after activity. This slide may be relevant to you. Okay, this is one of the most underlooked and underrecognized drivers of some people's diarrhea is the pills we take or the chemicals we make inside our body. And of course, we can take certain medications that do influence the chemicals inside our body. So let's start on the pharmaceutical medication. So some medications are commonly prescribed for IBS-D, such as tricyclic antidepressants, and these can slow gut motility. Serotonin levels in the gut can directly influence gut speed, and it can increase or decrease gut speed. It's a very complex process. Tricyclic antidepressants, or TCAs, can be prescribed for irritable bowel syndrome with any diarrheal element, and they're usually prescribed at lower doses than what is commonly prescribed for, say, anxiety, depression. So keep in mind, it might not be always it's going to help. It could be dose dependent. And also, if you experience constipation on the flip side, just so you know, a tricyclic antidepressant type medication might make someone's constipation worse. So have a chat with your doctor or pharmacist about that. Okay, certain medications can influence gut motility as well that are from this selective serotonin reuptake inhibitor category, SSRIs. SSRIs usually increase gut speed. Again, this is usually a dose dependent consideration. Usually, when we increase the dose of a medication that can increase gut speed, possibly we might see, well, you know it, increased gut speed. Certain medications like metformin, for example, if you notice your diarrhea started after you started metformin or got worse because of an increase in your medication, this could be one of the causes that we are overlooking often. Metformin in particular interferes with your bile acid recycling system. I will have a video on that shortly about bile acid diarrhea, so stay tuned for that. But yes, metformin can cause some diarrhea because of a slightly different mechanism as well. Stimulant ADHD meds. Personally, I used to be on one of the medications for ADHD that end in amphetamine, and these definitely I found increased my gut speed. Too much in my case, but some people it works fine for them and their diarrhea doesn't get worse, but I find this in general speeds up one's gut speed. Ask your doctor or pharmacist about other options for ADHD medication if you already have diarrhea predominance that might not influence your gut speed as much as one of these, for example. Tricyclic antidepressants, again, like I mentioned before, and GLP-1 medications. These can usually slow things down and can be helpful for those with diarrhea or IBS diarrhea. Of course, we don't take these just for IBS diarrhea. You always have to have the proper workup by your doctor first, but just know that there are lots of things that can be complementary in your care to help your situation in terms of gut speed and ideally not make things worse too, right? Okay, going on to the endogenous chemicals. So these are chemical messengers that are made inside our bodies. So there are a ton, but I'm going to especially just focus on a few. Motilin, ghrelin, these are our hunger and satiety and GI chemicals. These in general increase gut speed, as does increases in thyroid hormones. Estrogen hormones as well can increase gut speed. This is why people who were born with a set of ovaries, after going through menopause, they might find things slow down a bit because of drops in estrogen. Histamine, this is a chemical messenger that can definitely increase gut speed. On the flip side, endogenous chemicals like GLP-1 that's made inside your body, CCK, secreted, peptide YY, and progesterone can slow down gut motility. So again, if you're a menstruating human, you might notice big time swings in your diarrhea. Maybe it's worse right before your period, and maybe things slow down nicely in between. Or maybe you just have diarrhea all the time and it just gets extra bad just before you menstruate. So have a chat with your doctor about this sort of pattern and see if there's anything they can do to help for you. But those are some of the chemical influencers of your gut speed. Okay, dietary. I could spend probably an entire day talking about the effects of diet on increasing or decreasing your gut motility. But in general, I'm just going to zoom in on the ones that are the top triggers someone's diarrhea or definitely don't help someone's diarrhea. Coffee. Not because of caffeine. Actually, it's the chlorogenic acid in coffee, even decaf coffee, that can influence your gut speed and make it go much faster. So if you notice that after a cup of coffee, you're running to the bathroom, and the more coffee you have, the more bowel movements you have, it makes sense because coffee has both caffeine and chlorogenic acid. If it's caffeinated coffee, even if it's decaf coffee, it still has chlorogenic acid, still can move your gut. If you want to experiment with the difference between chlorogenic acid and caffeine, you can do some caffeinated black tea, which doesn't have chlorogenic acid. See if there's any improvement on your diarrhea, or swap completely to herbal. I personally would throw a rock at someone who told me to stop drinking caffeine, but it's good to know and anticipate a bowel movement if caffeine and coffee are one of your biggest bowel movers. Actually on the flip side, in someone with IBS constipation or constipation in general, this welcome nudge of the bowels can be quite the tool. So as you can see, the advice for IBS really, really needs to be subtype specific. That's why it gets so confusing out there. Coffee's good, coffee's bad. It depends on what subtype you are. In general, if you have diarrhea, coffee's not going to help diarrhea. In general, if you have constipation, that could be a good nudge. So keep that in mind. And this is why I talk all about subtype specific IBS care in all my programs, self-study and live. Fruit. So fruit contains sometimes the trifecta of things like, say, fructose and or sorbitol and or insoluble fiber. And these can pull water into the bowel. It's called osmosis. Is physics. So anyone walking this planet, if they ate a ton of fruit that has a ton of fructose or a ton of sorbitol, typically this is going to pull water into the bowel, and this usually results in increase in the movement of your smooth muscles around your intestines, meaning increase in gut speed, and usually winds up in increased bowel movements. So if you find after your smoothie that you have quite a few more bowel movements than you do on a typical day, this could be why. In general, I usually say keep smoothies to about the size of your fist and see if you tolerate that better, or add a scoop of soluble fiber to that. We'll touch on soluble fiber in a bit. Vegetables. Okay, so vegetables also can contain insoluble fiber and also mannitol. Anything that ends in all, erythritol, xylitol, lactocol, etc. Anything ending in all is possibly going to cause or exacerbate diarrhea because these are sugar alcohols and they're like water magnets. So vegetables also have their own little set of water magnets, much like fruit can. Not all fruit does, and not all vegetables do, but keep in mind if there is any mannitol or sorbitol or lots of insoluble fiber, any combination of the above can pull water into the bowel and increase stool bulk, therefore increase the peristalsis of this intestine, aka the squeezing of the smooth muscles in your intestine, and therefore increase motility. And in things when things get faster and stool has less time to dry out in the colon, that's why you wind up with watery or more loose bowel movements. Okay, so high fat or large volume meals, these tend to stimulate the gastrocolic reflex, leading to increased movement down the GI tract. In the last slide, we talked about endogenous chemicals. So, high fat or large volume meals typically tend to stimulate certain endogenous chemicals more, leading to increased movement down the GI tract, which can increase, obviously, the number and types of stools that you have. If you happen to be malabsorbing fat, like say in pancreatic insufficiency, or you have bile acid diarrhea, this could be double trouble for you, a high fat meal. So if you notice that high fat or greasier or oilier meals, even if it's just a big salad with an olive oil and vinegar dressing, really increase your gut speed, you might obviously work with a dietitian and see what you can do to mitigate these. And again, sugar alcohols and found in sugar-free products, even even enzyme blends that are supposed to help with bloating can be sweetened with things like mannitol. And again, when we pull water into the bowel responds by moving through it faster, and that is less time for a stool to dry out in the large bowel. So heads up, if you have an issue with digesting sugars like lactose or sucrose due to enzyme deficiencies, this can also pull water into the bowel. So even if you should be able to digest lactose and sucrose, for example, and you can't, this can make it act like, say, mannitol or say sorbitol or say fructose in high amounts. Because anything that isn't absorbed or digested higher up in the bowel is going to contribute to that osmotic load or that water pulling effect lower down, which again, more water in the gut or more bulk, gut senses it and moves things through faster. The faster things move things through, the less time there is to dry out, the more diarrhea you get. Okay, so this is why I'll end this slide with soluble fiber supplementation can be game changing for IBS-D because it does the opposite. It taps the brakes on an overly speedy gut. It holds on to water. It doesn't just create loosey-goosey poops. It actually forms bowel movements. It doesn't constipate because of that water holding capability. Never gets dried out, so it doesn't constipate. And while it's not my first therapy for IBS constipation, it can be helpful later on. But IBS-D, soluble fiber supplementation, I personally love Acacia Senegal, can be game changing for IBS-D. So on the flip side, we have insoluble fiber in fruit, vegetables, large salads, for example. If you pair soluble fiber with any of these, you might find that they're more easily digested. Okay, we're heading down into the final stretch. And I think I rearranged the order of these slides, but that's okay. Microbial influencers of gut speed. I get asked about probiotics essentially every day, and there is honestly inconsistent research that certain strains can modulate gut motility. The research seems more robust when it comes to diarrhea prevention, such as antibiotic-associated diarrhea, traveler's diarrhea. You can think of Saccharomyces probiotics like Florastor, for example. So there's more evidence that these can help for, say, diarrhea prevention. But once you already have diarrhea or IBS diarrhea, there isn't too much in by the way of a ironclad probiotic silver bullet here. There's some research for probiotics that are better for constipation. And if you're ever curious about what these are, head to probioticchart.ca. You can look up what probiotics have grade 1, 2, or 3 evidence for a variety of issues. But to this day, I almost never suggest a probiotic for IBS diarrhea. Antibiotics. On the flip side, I often do suggest someone goes down the route of antibiotics, and I'll explain why. It's widely recognized that those with IBS diarrhea have an abnormal overgrowth of certain gut bacteria that can lead to pain, bloating, and diarrhea, and even histamine intolerance. Interesting. Or sometimes bile acid malabsorption. Not included on the slide, but hot tip. Rifaximin, it's also called Zaxine in the States, or Xifaxin in the States, I believe. Rifaximin is a non-absorbable antibiotic. It's technically a eubiotic because it only kills certain gut bugs that we don't want. Also used for traveler's diarrhea. It can be prescribed for IBS-D because of this. It's an on-label use for IBS-D because of the fact that people with IBS-D are well known to often, not always, but often have disturbances in their microbiota, aka and small intestinal bacterial overgrowth, or an overgrowth of intestinal sulfide producing organisms. The rate of successful symptom reduction with one round of this is okay, 50 to 70%, but reoccurrence is so common with a relapse rate of quite a lot, 45 to 69% by 9 months post-treatment, depending on the type of patient. Recent studies suggested that adding N-acetylcysteine can boost this eradication at lower doses of the antibiotic. However, for a 50-50 coin toss that you have SIBO and a 50-50 coin toss that you're just going to get it back, in Canada, this drug is $300. In the States, I believe it's closer to $1,000 US. It depends on your insurance, whether it's covered or not. My point is, it can be a pricey investment when it might just come back anyways. But it's something to think about, especially if bloating is the last man standing symptom that you have. And if you have the financial ability to do it, we can chat with your doctor about it. Okay, so microbial influencers, pretty big on the gut speed, especially if you have IBS diarrhea, including SIBO or intestinal sulfide overproduction. If you want to sort of test this theory before you purchase the expensive antibiotic, you can also chat with your healthcare provider about getting a SIBO breath test that'll measure the amounts of hydrogen and methane in your breath. Neurological. This is going to lead up to why I use gut-directed hypnotherapy in every single one of my programs. And I'll tell you why. So neurological drivers of your gut motility, these cannot be understated. Oftentimes we want to just treat the gut and we forget that this big, beautiful human brain with all this, these spinal, nerves are attached to the gut and they're hardwired, but we often don't look at the brain. We want to treat the gut. So they are one, they are not disconnected. So ignoring the brain, it will do you a disservice. So I'll explain why. Stress hormones, say CRF, that's short for corticotrophin releasing factor, make the colon contract and secrete more, speeding transit and causing urgency. This might make sense. Think about the big presentation you're about to do or the big soccer game you're about to do, and usually probably if you're diarrhea predominant, especially, you probably need to take a poop for these things. If you're going through a stressful time, you might notice your gut and speed increase as well. More serotonin after meals and less reuptake boosts peristalsis, moving stool faster. So this is where these chemical meets neurological. Can't really separate those two, but I just added it here because this is a neuromodulator. Serotonin is made in our gut a lot. 80% of it's made in our gut. So it is involved. And threat-focused brain signals lift what's called the vagal brake and increase gut speed. The vagal brake promotes rest and digest, steadier gut function, and lower gut sensitivity. And the misfiring of the gut-brain axis can really mess with gut speed because of threat-focused brain signals. So essentially, gut-directed hypnotherapy and cognitive behavioral therapy, so far I'm recording this in November 2025. So far, these are the best approaches to rewiring the gut-brain connection and reducing the sort of influence of stress hormones and stressors on your digestion. I'm going to go a little deeper into gut-directed hypnotherapy because this is what I use in my programs, because digital gut-directed hypnotherapy is convenient. It's lower cost than doing in-person sessions, and I'm all about convenience and keeping things reasonably priced here. Gut-directed hypnotherapy retrains the gut-brain axis. So your gut-brain axis includes your brain, your vagus nerve, your gut neurons, so your visceral, the visceral sensing system that's around your gut. It even includes your gut microbiota. So the gut-brain axis in a relaxed state, that's what gut-directed hypnotherapy does. It helps people reduce their hypervigilance and reframe gut sensations. And it lowers that sensitivity of the gut and lowers the reactivity from stressors of the gut. So, how it exactly does this, if you want to nerd out, it alters activity in the anterior cingulate cortex, insula, and prefrontal cortex and amygdala, areas that cover interoception, pain, attention, and emotion. It can normalize gut motility because it calms the autonomic, that HPA axis, the stress pathways that are increasing and your vagal. Excuse me. It calms the autonomic HPA stress pathways, which increases the sort of parasympathetic or vagal side of things and decreases the sympathetic drive. This helps stabilize colonic transit, which in someone who's diarrhea predominant can help reduce diarrhea. Also, someone who's constipation predominant, it can help reduce constipation as well. It tends to be an equalizer. And it can reduce urgency as well. And it can lead to lasting improvement. So it can improve abdominal pain, bloating, stool form, frequency, and these and extraintestinal symptoms as well, like anxiety and quality of life. Um, and these benefits can be sustained in trials and even use of digital delivery as opposed to in person. The longest study done at the time of this writing was 5 years. 4 out of 5 people respond to gut-directed hypnotherapy, and 81% of people who get relief of their digestive symptoms keep them off for at 5-year follow-up. Um, so the results from gut-directed hypnotherapy, according to the research, this isn't just my bias because I love it and it's in my program and it's enabled me to stop having to eat low FODMAP breakfast, lunch, and dinner. But the results from gut-directed hypnotherapy are superior in effect and longer lasting than any medication or diet for IBS ever. This is a fact, not my opinion. And don't worry, I'll show you the research at the end. Okay, so let's wrap her up, shall we? My top tips to reduce your gut speed: gentler movement. Medication options, if desired, should be steered away from things that can move your gut too fast and towards things that can help reduce gut speed or normalize gut speed. Talk to your doctor as to which of your medications can speed up your gut and if there's a reasonable swap that you can do, that conversation can be worth its weight in gold and save you a lot of diarrhea in the future. High soluble fiber foods, so say, cantaloupe, say carrots, oranges, oats, so high soluble fiber food, and lower roughage food, anything with skins, seeds, peels, nuts, those are all high roughage. And then watch the fructose, watch the sugar alcohols, moderate the coffee, moderate the alcohol, and moderate fried oily foods. Alcohol we didn't touch on too much. It is a GI trigger. It also reduces the ability of your colon to reabsorb water. So that can make stools a lot more loose if you've noticed the next day. So that is the diet tips. Gut microbiome modification, if desired. You can try an antibiotic like rifaximin. Ask your doctor about it. See if it's right for you first, obviously. And there's some more evidence that rifaximin or antibiotics in this case can reduce diarrhea as opposed to a probiotic. And gut-brain therapy, the most underutilized tool in IBS treatment today. This is why it's included in every single one of my self-study programs or my live versions of the program. Before I did gut-directed hypnotherapy, I was on 3 rounds of rifaximin, and my diet was incredibly restricted. It was low FODMAP. I was suspecting histamine. It was just a big mess, and it cost me hundreds of dollars of enzymes a month, say Fodzyme, for example. Those are great enzymes, great tools. However, if I could eat whatever I want and not have to pay through the nose for it, that's what I wanted to do. And that's why I gave gut-directed hypnotherapy a try. And I'm so glad I did. And this is why all my programs include it. They don't rely solely on it, but they ask the question of how much. If imagine a pie chart of your diarrhea looks like this, or all your symptoms, diarrhea, gut pain, etc. How much of all this has nothing to do with food and has everything to do with the nervous system? That's what gut-directed hypnotherapy can help answer. Usually, well, the stats are 4 out of 5 people will experience 60 to 75% symptom relief by the end of the program, and it's a 6-week program. And we then, if they're in the live version of my program, we get to work on what's to deal with the rest of the 40 to 25% leftover symptoms. If my clients want to shoot for 100% symptom relief and 100% zero restrictions, I'm all for it, and that's what I do. Okay, if you're looking for the science, here's some of the science. This presentation is science-based. Of course, it's a combination of my clinical experience, personal experience, and science. And again, for general information only, but I really hope the materials in this presentation today, that is now going to live forever on my YouTube channel, have given you some insight and can help you spark conversation with your healthcare provider as to if any of these factors are driving your diarrhea, causing it, or making it worse. I really hope this helped you. Please let me know in the comments if it did. I live for reducing diarrhea. This is truly where I want to be practicing forever and ever. So I truly hope you enjoyed it today. And yeah, head to jessnourishes.com, grab an IBS-D mini guide if you are so inclined to learn more. And always looking to work with diarrhea patients who are Canadian residents at this time. Okay, be well. Talk to you soon.